Retinopathy of prematurity or ROP is abnormal growth of retinal blood vessels in the eyes of a preterm babies. Normally, the process of intraretinal vascularization completes just before the time of a full term or normal delivery. This particular disease affects to babies who are preterm, low birth weight, apnea, babies who are born with respiratory distress, babies who are on oxygen therapy, babies who are on blood transfusion. Usually this particular disease affects both the eyes. So whom to screen? So babies who are born with less than 2000 grams or babies with gestational age of less than 34 weeks and babies who are with associated risk factors like I have said before. When to screen? If the babies who are born at more than 28 weeks and weight more than 2000 grams, it is better to screen a minimum of not more than 4 weeks postpartum, like 1 month you have to remember. The babies who are born at less than 28 weeks and very low birth weight of less than 1200 grams, these babies are better to screen at 2 weeks post delivery. How to screen? A retina specialist will do a dilated fundus examination through indirect ophthalmoscopy and grade the severity of the disease. Milder forms of the disease will subside on its own. Once the disease goes into the severity and if it is diagnosed earlier, it can be treated with retinal photocoagulation or intravitreal antivascular endothelial growth factors. Advanced diseases with retinal detachment has to be treated surgically. So what we should remember? We should remember to get these babies for a retinal evaluation, especially the risk category babies. What every parents have to remember is a good rule like 1 month definitive retinal evaluation is mandatory for the preterm and the risk babies. And one thing you have to remember is no babies are born with ROP and always the disease occurs for both the eyes. If not diagnosed earlier, these babies, precious babies, will go for a blindness for the entire life.